I am helping myself by helping others. And believe it or not, it just gives me this immense sense of pride to know that I have gone through something and I'm willing to share it. I'm not ashamed to discuss it. And it's just unbelievably rewarding.
But what you could do is talk with your family members, go perhaps visit the websites I gave you. You will see that there are others, equally good people, who have gone through this, and just like Miss Sherland, they have come on to the other side.
Hello and good morning, mental health champions. We are joined by two individuals today bringing their unique perspectives all the way from around the country. So Sherland, Rakesh, thank you so much for joining me today.
Thank you.
Thank you, Vincent, for having us.
Of course, and we're bringing one journey today from a clinical professor and one from a personal testimonial. So I'm super excited to dive into this today, right here on a mental health break. Thank you, everyone, for joining us today and keeping this show a top 5% global show. Remember, you are never alone, and we have many guests who have come on and been courageous to share their story to help you live a little better today. Today's show is brought to you by johnford.com and empathyset.com. Be sure to check out his Empathy app in the App Store to help you along your journey today. And I don't do the introductions anymore because I feel the guests can give better ones than I can. We always like to start this show with the before, the right now, and then we'll end up what's next for you. So, Sherland, please share your mental health journey from wherever you feel comfortable.
Well, I am suffering from major depressive disorder and I'm bipolar. And in 2018, I was diagnosed with TD and no one had any idea what was causing it until I went to see my mental health professional and he was able to diagnose it.
And was it a sign of relief when you were diagnosed, or walk us through what that was like when you finally had some answers?
Well, I have to tell you that the TD affected my face and the left side of my mouth was just sagging and people would walk up to me and ask me when I had a stroke. Not if, but when. My enunciation was slurred. I just became this terrified person of going outside and meeting people because of how I looked. And after the diagnosis, I was able to have hope. And I cannot tell you how much hope is underestimated. I got hope. I got on a treatment plan and I was able to get on with my life and continue my treatment plan and continue with my life, social life.
Well, congratulations for how far you've come, and I can't wait to get to know you a little more throughout this episode and learn some tips that work for you. But we'll switch over to our next guest today. Please share what brought you here today, your mental health journey from wherever you feel comfortable.
Yeah, thank you, Vincent. And I saw you give a nice thumbs up to Sherland when she said hope is important. I totally resonate with that. So thank you. And you also said something, you're never alone. I love that. So my name is Rakesh Jain, and I'm a psychiatrist. I'm a clinical professor of psychiatry, and I've known Miss Sherland now for a while, and she's one of the bravest people I know because Tardive Dyskinesia, Vincent, it is a common condition. It happens in people who have been on these often life-saving medications we call atypical antipsychotics, often used in bipolar disorder, even in schizophrenia. And it's really my pleasure to be speaking with you on behalf of Teva. And as I'll answer your questions, I will make sure that I stick to the FDA package insert for Austedo XR. And my mission, honest to God, is to make sure that I help patients like Sherland. And many of the patients who are listening to you right now, Vincent, are themselves going through a mental health journey. And if they run into tardive dyskinesia, I want to make sure they can identify it accurately and that they can seek appropriate treatment.
What would you say are some maybe early indicators or some things where we can diagnose this correctly, like you just said?
Yeah, well said, because the first point of contact really is the patient and the patient's family members. So it's a combination of both. And Sherland is probably going to remind us that it was both her and her family who noticed the challenges. So generally speaking, tardive dyskinesia, it's a often chronic neurological difficulty that almost always, like Ms. Sherland, happens in the face. And Vincent, I'm looking at you right now. And as I look at you right now, you know what I'm looking at? I'm looking at your eyes. I'm looking at your lips. I'm looking at your face. I'm looking at your jaw. I'm looking at your neck, because that's how we humans connect with each other. And that's where tardive dyskinesia, these abnormal movements, I'm going to show some of them to you. And I'm exaggerating it. These can happen for our patients. And the biggest challenge, of course, is impact. Impact. The movements themselves are very problematic. But what I found through my research, as well as patients like Ms. Sherland educating me, there are at least 4 areas of suffering. One of them is physical, chewing, talking, walking. But the other is social. When you interact with people, the psychological and the social problems can be huge. And then the final can be vocational. I'm a psychiatrist. If I developed tardive dyskinesia and if I couldn't speak properly, that would be a big challenge. So Vincent, I want your listeners to be aware that tardive dyskinesia is not their fault. 2, it should be identified early. So if you see something, say something. And then obviously one of the best websites I've encountered ever on this issue is actually called tardiveimpact.com. tardiveimpact.com. And it's chock full of patient stories and testimonials and advice on how to identify it and then hopefully get treatment.
Well, thank you for sharing that tip, everyone. Please pause, write that down, jot it into your internet browser, and go ahead and take a look if it applies to you. But we're going to switch back to Sherland. As you began to recover, you were finally diagnosed correctly. What are some things you started doing to take care of your mental health now that you were on your road to recovery? Some things that worked for you.
That's actually a good question. I would like to add that I'm sharing my story based on Teva, and I'm getting compensated. And this is my personal journey. After I got my treatment plan, I was able to socialize more. I wasn't embarrassed. I wasn't afraid to drive a car and think that a police officer thought that I was drinking or any of those things. And I got a great deal of support from my family members.
So the power of a support system is good, you're saying?
Yes, absolutely. I have to tell you that there was a time when I didn't want to be seen by anyone. I was just so ashamed of what was happening with my body.
And now you've come so far and you're doing all this advocacy work, so helping everybody else out there. What are some things you do now to take care of your mental health?
Well, I interact with people more. I have to tell you, life is much sweeter after you've gone through a blank period in your life and then you see the light. I am on a treatment plan, which I follow. I follow up with my mental health professional. By doing this, I try to get the word out so that other people who have TD don't have to choose between the treatment plan or TD. They can do both in tandem.
Yeah, thank you for sharing all that. Do you have a particular resource other than what he just shared? Another place where if you have TD, they can go and find help?
Well, actually, I do not. I actually speak with my mental health professional, and he has been very, very helpful with sharing information, as well as Dr. Jain. He has educated me more than you would ever know.
Really? I have? I'm glad to hear that, because the truth is, Ms. Sherland, you've educated me more than I've educated you. But Vincent, there is a website that I would like to add, and it's UStedoXR.com, USTEDOXR.com. It's a medication that's been approved by the FDA for the treatment of tardive dyskinesia. So if it's appropriate, do talk to your healthcare provider, because as Ms. Sherland said, if tardive is not identified and the impact grabs hold of your life, the damage is extensive. We don't want it.
I love that. And the reason I was diving into this, because I want to encourage everyone listening on today that It may be hard and challenging at first to speak up and ask for help, but speaking with a mental health professional or a peer or a family member or a friend might just be the first step in that line of things you need to do. Look how far she's come, and you love your profession. I'd love to ask now, we all do things to take care of our mental health. What are some things that you do?
I have tried yoga. I've tried playing the guitar. I try to get as far out of my realm of comfort as possible. I even play the piano. What I'm doing is I'm just trying to celebrate life in a way that I haven't done before. I am socializing more. I am willing to, I have family members who suffer from mental health disorders, and I am proud to tell them how far I've come.
I love how you highlighted something there, creativity, playing the piano, doing these things. This is good for our mental health and everyone. We have around 60,000 thoughts each day. So if we're having bad or poor thoughts, we could switch them up by doing something creative, drawing, playing an instrument, walking in nature. How about you, Dr. Jain?
Yes, sir. So I wish I was as talented as Miss Sherland. I'm not, but I relish in her creativity. I love to physically exercise. That's been really important to me. I also like to meditate. Yoga I'm beginning to get into, but meditation has been great. And recently, Vincent and Miss Sherland, I have discovered the power of poetry. Just recently, all the way into my and just today, I received 2 poems from my friends, 2 completely different friends that just are balm for the soul. So that's what I do.
Oh my goodness. I don't know if I have your agent's email. I got to put you in an email connection with my buddy Renz. He's out of Miami. I met him as a book coaching client maybe a year and a half ago, and he has a poetry book, and he goes to all these poetry exhibits. I don't know how often you're out in his neck of the woods, but either way, I'll link you up with an email. I think it'll be a good point of contact. And Renz, if you're listening on, keep up the great work. He joined me for our Thanksgiving episode last year, talking about things we should be grateful for in this world that prioritizes a lot of things other than that. But I now want to move back to Ms. Sherland, as you say. I always like to ask each guest, and then we'll swing it back to Dr. Jain. If you could give a piece of advice to someone out there who is struggling today, can't see the light, what can you offer them?
Contact your medical health professional, and he or she will hopefully recognize that you have TD. My situation, I wound up going to the emergency room when I was asked if I had a stroke. And it took me a while to figure out what was going on. And my medical health professional identified it right away. My advice is don't give up. Whatever you do, do not give up. Go to your mental health professional, get diagnosed, learn that you don't have to make a choice between taking your mental health medicine or suffering from TD. There is hope.
I love that. And like you started the show with, hope. If we don't have that, it's very hard to keep pushing forward. Or I wouldn't say we, I'm not going to, at least for me, right? I need that hope. I need something to keep pushing me forward. Every morning I wake up just so excited to do these conversations. I love my career where this is my therapy sessions in a way, right? I do a show a day, say, or a couple shows a week. I'm having open mental health conversations with people with vulnerability on the table, no judgment, and above all, inspiring anyone who catches the episode because it's not easy to get up and do it every day. I know that, but you are doing great if you are listening to this show today, because that means you keep pushing on. Now, Dr. Jain, some advice from you as well.
I really like your plan, which is one of the powerful ways to help oneself is to help others. And psychiatric illnesses and brain injuries, something that you are a real expert in, are often seen as issues of shame. And if you shine the light of knowledge and connection, guess what? Once the light is shined on it, those problems recede, they back away. So I'm very supportive of what you and Ms. Sherland are doing. And with tardive dyskinesia, the problem often is hiding in plain sight. The face and the tongue, the hands, the toes, actually telling a pretty significant story. So many of your listeners who may have tardive dyskinesia are hiding. And I understand that they are. But if you can't, with the help of your family, come out and see your healthcare provider. But what you could do is talk with your family members, go perhaps visit the websites I gave you, austedoxr.com or even tardiveimpact.com. You will see that there are others, equally good people, who have gone through this. And just like Ms. Sherland, they have come on to the other side. So you go for it. We healthcare providers want to help you when it's appropriate.
I absolutely love that. And again, therapy may not be for everyone, and that's okay. But what should be for everyone is at least reaching out to find out what you can do on your own. The internet, it's a beautiful thing. It's what brought us together. But in this information age, there's also a lot of discreditable information, you could say, to be kind, where we don't have professionals like Dr. Jain coming on and telling you some facts, patients coming on, telling you exactly their experience, how she recovered, how she got through the tough times, some things that worked for her. That's some of the value I hope I am bringing to everyone who tunes into these podcasts, because you never know whose perspective is going to resonate with you most. It might be from where they're from or what they experience or the type of things they do to improve their mental health. They've given a lot. And remember, it's not a one-size-fits-all mental health fixes. So I hope some of these do help you all listening on. I do, Dr. Jain, want to dive into one thing towards the end of the show. I've learned you've done a ton of research on an array of areas in the mental health space. Something that didn't come up today, but I know is also a very common challenge for people in this day and age is ADHD. You've done a lot of research on it. What are some things we can do if we can't afford therapy or we don't believe in therapy to start combating it on our own?
Yeah, I love that question. ADHD is common. By the way, interestingly, ADHD is also common with depression. It's also common with bipolar disorder. So I actually have patients who have ADHD and other disorders who also have tardive dyskinesia. But when it comes to ADHD, if medications or psychotherapy isn't on the books yet, some of the things you can do is actually meditation. Mindfulness, surprisingly effective at centering you. The other is keeping a scheduled book, using your phone for reminders, using your Google Calendar or whatever calendar you use, setting reminders. The ADHD brain, Vincent, is a smart brain. But what it needs is to be jogged and tapped on the shoulder often. That's it. So don't doubt your intelligence. Just use systems around you to help you.
I love that. As we're winding down the show, that's some great advice. I live and die by my calendar. I time block every day before bed. I have 3-4-. I start unusually early, right? But I go through and my stress is lower, my anxiety is lower, and I accomplish tasks way quicker because I'm planned, I'm organized, and go right from there. So I absolutely love that. Sherland, what are you looking forward to this summer?
Well, I am looking forward to doing more of these podcasts. I feel like I am helping myself by helping others. And believe it or not, it just gives me this immense sense of pride to know that I have gone through something and I'm willing to share it. I'm not ashamed to discuss it. And it's just unbelievably rewarding.
Oh, well, you definitely gave it your all today and helped so many people in the process. The same with you, Dr. Jain. I can't thank the both of you enough for bringing this great tag team to my inbox, right? I don't often get two guests on the show at once. We've done a few as the group interviews, but I think they're often very fun. I don't feel that when you have the right two guests, it's hard to manage. You both were a joy to bring to the show. We'll start with you, Sherland. Where can we find you online? Where can we say hello?
I am also a writer, a published writer. You can find me on my email, Sherland Peterson, 1@gmail.com. If anyone wants to discuss my journey, then I'm certainly willing to discuss it with them and be as honest as possible.
Yeah, you said at gmail.com, right? I'm putting you in an email now with someone who I know has mental health conversations. I can't guarantee what their schedules are, but I think it would be beneficial for you since you do want to share your story. They focus on sharing patient stories. So I think there would be some value there. And Dr. Jain, where can we find you online? Where can we say hello?
Yeah, I'm easy to find. You just Google me. But I do think the 2 websites I gave are extraordinary resources.
Please revisit them.
Yeah, so ostetoxr.com. That's a beautiful link to use. The other one would be Tardive, TARDIVE, impact, IMPACT.com. Even if you don't have tardive dyskinesia, your family members, your friends, your colleagues may have it. So even if you spend a few minutes on that website, Vincent, later today, you will find yourself suddenly very educated about tardive. And that's my purpose. I want people to be educated about it.
Thank you so much. And that's why I was saying before, we need the right information in the right hands. And you both did just that. So thank you so much. Everyone, be sure to go check them out online. And this is a mental health break. Be sure to subscribe to stay current with the next mental health rock star. And my name is Vincent A. Lancy. You can find me online anywhere at my name. And the show is brought to you again one more time by our show partner, John Ford. He has the Empathy Set. He has an empathy app. He's helping us all stay level-headed. And, of course, Coming Alive Podcast Production.com. And with that, we are signing off today. Both of you, thank you so much.
Goodbye now.